Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Miami, Broward, and Palm Beach County. You can reach us directly, 954-717-7027. I am your host, Louise Gomez. Welcome to the show, everybody. And today I am delighted to introduce everybody to Ed Salazar. How are you today, Ed?
Just fine, Louise, and it's a pleasure to be back again.
Absolutely. And you are the Director of Pulmonary Hygiene. And how long have you been with? I think I asked you this last time.
Well,
how long has the program been running? How about that?
I'm very proud to say that we started this pulmonary hygiene program at All County Healthcare in 2011.
Wow.
And it was unique in the fact that it's a form of therapy, respiratory therapy, that is a lung conditioning technique to expand a patient's lungs. We call it recruiting lost lung volume. If people have parts of their lung that have actually collapsed, the little tiny air sacs,
yes,
the alveoli.
I've heard of.
If they actually collapse, this therapy will re-expand them. If they're having difficulty clearing their secretions, then this technology helps with airway clearance. So it's for lung recruitment and airway clearance, overall lung conditioning.
I was very impressed to know that last time we spoke, I learned even for infants. Is that right?
Yes. It's a very, very popular technology in most neonatal units. It's called high-frequency ventilation.
Okay.
Most mechanical ventilators, they ventilate at, a range of someplace between 8 and maybe 24 cycles per minute. Neonates maybe a little higher. But the ventilation rates with IPV are usually in the range of 300 to 600 cycles per minute.
Wow.
There are other forms of high-frequency ventilation that go much higher than that. And the reason for it is the rationale is that you're delivering very, very small boluses of air, and these little boluses of air are coming in so rapidly that it actually forms like a jet stream. Now, this jet stream of air going into an airway is always going to seek the path of least resistance. So the path of least resistance going into the airway is going to be right down the center. Now, as these airways get smaller and smaller and smaller, as you go down through the bronchopulmonary tree, this jet of air continues to seek out the center.
Interesting.
Now, if that airway is obstructed, eventually those percussions, those boluses of air, are going to breach that obstruction. They'll get behind it. Now, once they get behind it, they get to the terminal unit where the alveoli is. If that alveoli is collapsed, it'll expand it.
Wow.
If that alveoli is congested, it'll clear it. Now, the air's got to come out now, but the air has to come out at the same time it's going in. So where's it going to come out? It has to come out around the wall of the airway. So it's going in down the center of the airway, coming out around the wall of the airway. And that spiraling motion as it comes out is what affects the clearance. So because anything attached to the wall of the airway is going to be brought up with it. So it doesn't matter whether the patient has an ineffective cough or not, we can still get airway clearance. And that's what makes it so efficient and so useful in neonates and in patients with bad pneumonias, severe inflation. So with cystic fibrosis kids is where it really excels.
So Ed, People are listening right now, and they probably are thinking, well, I'm on oxygen, right? Some people, you know, they have to have oxygen. So what is the distinction? Like, they're thinking, how do I do this? I'm already on oxygen. Like, how would this work? Do I qualify to get a treatment?
Well, it's not, being on oxygen doesn't preclude you from being able to take this therapy. The therapies can be delivered with the same type of mouthpiece that they use for their regular aerosol treatments. If patients have difficulty managing the mouthpiece for whatever reason, you know, just muscle fatigue or something,
Sure.
then we can use a mask.
Okay.
You know, and it's a very comfortable, soft, pliable mask. And because we're using low pressure, it doesn't have to be strapped onto their head,
Right.
you know, like a BiPAP or a CPAP
Yeah,
machine.
those look uncomfortable.
No, nothing like that.
Uh-huh.
In many cases, the patient is able to hold the mask themselves to their face
Okay.
and do the therapy. So that, you know, being on oxygen is not.
They're two separate things. One, the oxygen is just oxygenating the body, and then the IPV is actually giving that whole treatment, that whole, the way you explained
Well,
it, the whole treatment.
If the reason someone is getting oxygen is because they're having what's called shunting, you know, if you put oxygen into the lungs, but that oxygen never comes in contact with the capillary blood, then it's not going to get into the bloodstream. And the reasons that doesn't happen are, you know, again, congestion down there or something. So you can make oxygen therapy more efficient in many cases by using an airway clearance technique, so that you alleviate that shunt, and more of the blood being pumped through the lungs comes in contact with the oxygenated alveoli.
So I would imagine if a person is on oxygen and then they do the IPV therapy, does that help them to wean off of the oxygen? Maybe they won't need
It certainly can.
It can, right?
There, you know, unfortunately, there are some situations, advanced COPD, you know, emphysema and things like that,
Right.
it's irreversible. But what we endeavor to do at All County is just to make what they have left more efficient. When in many cases we can improve that efficiency to the point that their exercise tolerance improves as well, and their overall quality of life gets better.
So how can somebody get treatment? What do they need to do? Can they just call All County directly and make an appointment? And how does that work?
Well, they have to have they have to have a prescription from their doctor.
From their doctor.
It has to be prescribed.
Okay.
And All County is a Medicare home health agency. So if they are on another form of insurance other than traditional Medicare,
Okay.
then there may be an issue. But you know, the people at All County, our intake coordinators, our supervisors, they'll do everything they can to try to get it approved if at all possible.
I see. And so the nurses would come and administer that if that were the case, and they were to get everything approved and whatnot. So they would prescribe it, like a certain amount of days that they'd come, or.
Well, that's why I'm with All County. For some bizarre reason that nobody understands, Medicare will not pay for a respiratory therapist to treat a patient outside of the hospital. So in order...
Has it always been that way, Ed?
Always.
Okay, so it's nothing new,
No.
nothing changed, it's just that's how it's
No,
been. Okay.
no. And you know, appeals have been made. The American Association of Respiratory Care has lobbied Medicare to get this changed. But nothing, you know, I've been a respiratory therapist since 1972.
Oh, wow.
And nothing's changed
Oh,
in all
gosh.
that time. So my wife was the director of nurses at All County in 2011. And I was telling her about my frustrations because I believe in this therapy with all my heart. And she said, well, can you train nurses to do it? I said, well, of course, you know, it's not rocket science. It's not that difficult a thing to do.
Right, right.
So my job at All County is to create a team
Nice.
of nurses that are trained in how to deliver the therapy. If people leave and new people come in, then and we
Sure.
do updated training from time to time, different techniques and things like that. And we've been extremely successful.
I love that.
One of the leading causes for readmissions. If someone's treated in a hospital, discharged, and then they have to be readmitted within 30 days,
Yeah.
COPD, exacerbation of COPD is one of the leading reasons. And the statistics for all county, their readmission rates are substantially less.
That's
than
how
the
we know it
national average.
works.
That's how we know it works, right?
That's how we know
And
it works.
yeah, that's why the doctors call us.
That is amazing. I know there's a lot of studies out there. I think last time we spoke, you were talking about a study that was done maybe in the VA hospital, maybe, or something.
There was a VA hospital in Wyoming.
A case study, right?
There was a VA hospital in Wyoming that I guess the director of the respiratory therapy department there had become acquainted with IPV therapy. And the VA population has a very high incidence
Yeah, I
of
imagine.
COPD, emphysema, bronchitis, things
Sure.
like that. And he knew that this could help this patient group. So, in order to justify the therapy for patients, he first set up like a clinic, and he took the frequent flyers, they call them, people,
Yeah, sure.
people that are frequently exacerbating and showing up in the emergency room. And he got a group of them to come in on a clinic situation to get regular treatments with IPV therapy. And he showed over a 24-month period that the patients that participated in this clinic operation had substantially fewer exacerbations.
Wow.
So in that way, he was able to justify the VA actually purchasing
Nice.
the IPV machines for the patients individually so they could treat themselves at home.
Oh, wow. That's a great investment. Wow.
No, well, it worked for them.
Yeah,
It worked out very well for
absolutely.
them.
Wow. It's all about spreading the word and letting people know there's options, right? There's options out there. Because I know All County is the only home health care agency in the state of Florida that offers this therapy.
Well, I can say that with confidence because I was the distributor for the manufacturer.
Wow.
And I went to all of the large home health agencies. I went to the national agencies
Okay.
and gave my little pitch, and every one of them said this is a great idea until we got down to acquisition cost. And once they found out what the cost of the equipment was,
Yeah.
then they weren't sure
Yeah.
that it was such a good idea. But at All County, at the time, we sat down with Mr. Biazzi, and I gave him the same pitch, and he just looked at my wife and said, "Well, will this help our patients?"
I love
and she
that.
said, "It absolutely will." And he said, "Well, can we make any money?" I have no idea. So he says, "Well, I'll buy one machine
Nice.
and we'll see how it goes." And very, very rapidly, our success rate was fast enough and then we would, go to, I knew a lot of, I've been a respiratory therapist down here for a long time, so
Yeah.
I knew a lot of pulmonologists. And so we rapidly developed a good core of physician referrals. And
Wow.
the rest is history.
Amazing story. Well, sometimes it takes taking a risk in life for things to, come to fruition.
Well, as far as, could we make money doing it? Well, another thing about All County that is outstanding is that the amount of care you get
Yeah.
is not predicated on what Medicare will reimburse.
I love that. We got a quick commercial break. We're going to come back and continue that conversation.
Okay,
We'll be
very
right
good.
back, everybody.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, everybody. Thank you for joining us. We are back with Ed Salazar, who is the Director of Pulmonary Hygiene. We are talking all things IPV therapy. Can you remind me, what does IPV stand for again?
Intermittent pulmonary percussion therapy.
Okay, got it.
Intrapulmonary percussive ventilation.
Got it. So IPV is a lot easier. So we were discussing before the commercial break, All County, and they took a chance.
They took a chance.
They took a chance on the device and you and everything.
Yeah, I'm so glad they did.
I know.
Because finally, I had some recourse to provide therapy to some of these COPD patients that, we knew would benefit from it so much. But, as I said, unfortunately, you still have to get authorizations.
Yeah.
And All County has become very proficient at attaining those authorizations, through the Medicare channels. When I've worked with other home health agencies that take some of the other forms of, like Medicare Advantage programs,
Yeah.
we haven't had such good luck.
Really?
Yep. And most of it, I think, and this is just an opinion, but from what I've been able to observe, part of the problem is that many times to have an effective outcome with some of these patients, you have to see them. They have to be treated 10, 15, maybe 20 times.
Sessions, yeah, periodically.
And that many visits does not fit into the business model for some of these other insurance programs.
Sure.
They 5 and done. But with All County, they just say, okay, whatever it takes.
I love that.
We had patients that we've had on service for extended periods of time, and it was not a moneymaker.
I know.
But they want to have added value to their overall service.
See, I like that.
Yeah, and All County, they have great wound care, they have great diabetic care. It's a good full service agency. And by having this unique pulmonary hygiene program, it's just added value to the overall agency.
Absolutely. And I imagine post-COVID, long haul COVID, right? People don't know, like, what's this, what's that. They're benefiting
we
from
have
those.
a great COVID story.
Oh, please tell.
We did a presentation for the discharge planning group at Good Samaritan Hospital, and then COVID hit.
Oh.
And they said, okay, well, I'll tell you what, every one of our patients that have been admitted for an exacerbation consequential to a COVID infection, when we discharge them, we'll put them in your service, assuming they were Medicare patients.
Sure.
And there were at least a couple dozen referrals that we got that way. Not a single one of them required rehospitalization.
Wow, look at that.
Yeah. And I mean, again,
That's impressive.
and I thought so.
That is very impressive. Wow. What about rise in concierge home health? I'm sure you're getting a lot of self-pay home health or different types of patients.
You know, Louise, that's one of the that's one of the dilemmas of healthcare.
I'm sure.
All County, they also have a registry, a very, very good nursing registry. So patients that need extended care, they need someone in the home for 4 hours, 8 hours, and
Right.
so on. Then there's a method for that. But you know, there's limitations there. You know, when you have patients who are very medically complex, and more of those are being sent home.
Yeah.
Say, for instance, if they need IV antibiotics for an extended period of time, there's it's called a PICC line.
Yeah.
Okay, percutaneous
Sure.
indwelling catheter. So it's a little longer catheter that you know,
Yeah.
goes into a large vein, so that they can confidently give extended antibiotic therapy over a longer period of time. Well, you know, you have to have more skilled nurses to do this,
Sure.
and this has been one of the factors that has given rise to an increase in concierge healthcare, home healthcare. There's an agency that I'm very familiar with, Private Care Solutions in West Palm Beach.
Okay.
You know, they go out of their way to hire, you know, the best nurses, the most efficient nurses, capable nurses. But the dilemma is trying to get, you know, insurance companies to
Yeah.
pay for that.
Yeah.
So unfortunately, that kind of care is limited to people that have the resources to, you know, pay for it themselves, out of pocket.
Have we had Medicare cuts recently that is affecting the ability for people to get that home health or any other services per se?
Not that I'm
Okay.
not that I'm aware of. I don't think that any of the funding allocations for Medicare have really had anything to do with that.
Okay.
I'm sure we could get someone else from All County that would be
Sure,
more knowledgeable
sure.
about that could
It's okay.
taught you that. With,
No,
you
it's
know, with
okay. I
more
was just
surety.
curious because it's like the aging population is increasing daily. I would imagine we need more services, you know, baby boomers every day. So it's just, especially in South Florida, right?
Right.
We
especially
have
in
we
South
have
Florida.
the demographic, we have the, you know, the need for it.
I have, you know, right now I have a couple of patients that I see privately. They have the resources. You
They're blessed. They can do that.
Yeah, exactly. And they do very, very, very well. We have one woman that we see who does not have the resources, but she's an ALS patient that you know, we became attached to, quite
Yeah.
frankly.
Yeah, because you see them, you go through the sessions with them, and you get to know them and their story, right?
And you know, so we've carried that patient for quite a while now.
Wow.
Even after insurance just decided they were going to stop paying.
Wow. Yeah.
So, you know, if there's anyone listening, anyone out there that has any suggestions on solutions for us on that,
Right.
glad to
Give
hear
us a
it.
call. Yes.
But if anyone listening does know of somebody
Yes.
who they think
would benefit.
would benefit from the program that we offer, you know, please get in touch with us.
Yes.
You know, I think they put up our contact information.
Yep.
Right?
954-717-7027. So that's for all services, and then we also have the, like, if they need services as far as taking someone to the medical, to an appointment, or other, you know, services
Sure.
that are necessary for the, elderly.
And, please keep in mind that All County is a tri-county agency.
Yes.
We are licensed in Dade, Broward, and Palm Beach County. So we cover a wide
Spectrum.
geographic
Yeah,
area.
yeah. Well, very good. We have 1 minute left. Do you have any last call to action for anybody?
If you think that you are suffering from some kind of a chronic condition, the earlier it is diagnosed,
This is true.
the earlier you get tested or whatever, put faith in your physicians. Broward County is blessed with some very, very fine pulmonologists and some pretty good respiratory therapists.
Yes, I agree. Thank you so much. Well, thank you, everybody, and we will see you next week. It's been a pleasure.
Always.
Thank